Hello, let's discuss diagnostic criteria for acute cholecystitis. Acute cholecystitis is the inflammation of the gallbladder, either due to gallstones or without gallstones. Calculous cholecystitis or acalculous cholecystitis. There are 3 diagnostic criteria for acute cholecystitis. The first one is look for local signs of inflammation, like the Murphy sign, right upper quadrant pain or tenderness, or the mass. So these are the local signs of inflammation of the gallbladder, which is acute cholecystitis. So Murphy sign is when there is interruption of the inspiration when we palpate the right upper quadrant region. Then there will be right upper quadrant pain or tenderness or mass. So these are the local signs of inflammation. Then the second criteria is the systemic signs of inflammation. Okay, so for what systemic signs we will be looking for in the acute cholecystitis, it include the increase in C-reactive protein, okay, which is the acute reactant or marker for the acute inflammation. Then the third one is the leukocytosis increase in total leukocyte count. These are the systemic sign of inflammation. Then the radiology finding. Look for the radiology finding which is characteristic for the acute cholecystitis. In the ultrasound we can also do the X-ray erect abdomen and CT abdomen with IV contrast. Okay, so these are the criteria for the acute cholecystitis. Then how we will interpret these criteria. So the diagnosis of the acute cholecystitis will be suspected if there is one or more than one local signs of inflammation, plus one or more than one systemic signs of inflammation. So if the one local sign of inflammation are more than one or plus one systemic signs of inflammation is present, then the diagnosis of the acute cholecystitis will be suspected. Then their definitive criteria for a definitive diagnosis include the one or more than one local sign of inflammation plus one or more than one systemic signs of inflammation plus any radiological signs characteristic of the acute cholecystitis. So this include the definitive diagnostic criteria for the acute cholecystitis. So this is about the diagnostic criteria for diagnosing the acute cholecystitis. Thank you.